My name is Maria Tovar. My presentation is about Otitis Externa. To understand Otitis Externa, understanding the anatomy of the ear is very important. The auricle is the outside of the ear where the external auditory canal gets infected or the inflammation and the redness happens. So that little tube that connects to the tympanic membrane and the auricle, that's what Otitis Externa refers to. This presentation on Otitis Externa has been divided into three phases. The first phase discusses the disease, the actual pathophysiology, and the impact on the population. The second phase is about the treatment, the pharmacological guidelines, and the side effects from the drugs. And the third and last phase is health promotion, making sure that the treatment is being effective, preventing Otitis Externa, and also preventing reoccurrence of Otitis Externa. The first phase, the disease of Otitis Externa, is based on the information collected from the book written in 2013 by Usetine, Smith, Chumley, and Mayuse Jr. They explain that Otitis Externa is inflammation with infection of the external auditory canal. What happens? The pathophysiology, disruption of the normal flora due to trauma. It could be from hair follicles, excess or decreased cerumen, or moisture that goes into the external auditory canal. Now, Otitis Externa affects more adults than children, and occurrence of this is about 10%. The second phase is the treatment for Otitis Externa, which discusses the drugs and the side effects. Apodarsky, McPhee, and Ravu explain that the treatment for Otitis Externa is analgesics because it is painful, also topical. Quinolones like ciprofloxacin, aminoglycosides, and a combination of antibiotics and steroids, for example, Cyprodex, and acetic acid or aluminum acetate for prevention. What are the side effects of this topical eardrops? Ototoxicity. Very careful with ototoxicity where you lose hearing. Contact sensitivity from the actual antibiotic or the medication from the eardrops could cause irritation, even an allergic reaction such as numbness or swelling to the area, difficulty breathing, unusual taste in the mouth, discomfort because of the fullness sensation, ear discharge from the drops or the medication that is working, itching in the ear, and a headache. These are side effects listed in the prescription list in 2017. It is very important to teach our patients how to instill ear drops. Drugs.com has 8 steps to follow when applying eardrops. The first one is to wash your hands. Second, hold the bottle in your hands for a few seconds. Third, have a gentle 10-second shake. Open the bottle but do not contaminate the tip of the bottle or the cap. Fourth, tilt the head to the affected ear. If you are over 3 years, pull ear up and back. 6. Squeeze order amount of drops without touching the ear. 7. Keep head tilted for 3 to 5 minutes. The last step is if you have the other ear affected, wait 5 to 10 minutes for the other ear to tilt the head. The last phase of my presentation of Otitis Externa is health promotion. Monitoring treatment. Is it working? Pain reduction happens after 2 to 7 days of treatment. No hearing problems if you're able to return to your normal hearing state. Prevention. How do you prevent this from happening? Well, first is minimize the water. Either limit the swimming or the amount of time you swim. Minimize soap use around the ears because that could dry the skin and later cause trauma. Use tissue as a wig if you are a swimmer. Use ear drops as preventive measures that have alcohol or acetic acid. And do not wear earplugs during swimming. They can cause trauma to the ear canal. Health promotion. Make sure to tell patients not to swim in polluted water and to prevent ear trauma by using cotton swabs, putting staples or anything that they feel they need to use to scratch the ear. The ear canal should stay away from fingernails, anything that's going to cause trauma or cut the skin. Now we're going to apply our information on Otitis Externa to the case study. Our patient Jay, who is a 16-year-old boy in the swim team, who presents to the doctor with symptoms of sudden right ear pain to touch and a feeling of fullness. These are clinical symptoms for Otitis Externa, which is the pain. What happened to him? So because of the water from swimming, he started collecting moisture and probably altering the pH of the ear to a higher pH, which allowed other bacteria to grow in the ear, and that's what caused the infection. Now, how are we going to treat it? We're going to use aminoglycosides or quinolones for him. I believe in his case, the swelling is not intense or severe where we need to use a combination of steroids and antibiotics. So just the antibiotic would be enough. We need to make sure his mother knows how to instill the ear drops. So review the 8 steps of administering ear drops to the right ear for him. And last, Jay needs to know what to do to prevent this from reoccurring, which is make sure he dries his ear completely, not by using a cotton swab, but to using a tissue as a wick to help absorb any leftover water inside the ear canal. Another thing is he might want to consider using acetic acid ear drops or aluminum acetate ear drops. Now, some of the side effects that he might experience using the topical ear drops are differ or affecting his taste, which he might lose his appetite. So we need to encourage him to eat frequently, his small frequent meals. He might also develop ototoxicity, which is destruction of the ear, which we don't want that to happen. So report any sudden loss in hearing or allergic reaction that could be in severe swelling or difficulty breathing. Jay cannot go back to swimming until the treatment is completed. Once the treatment is completed, he can return to swimming with those precautions. I wish him great luck.